and this is the Community Problem and Population Analysis Project, where we're going to focus on abuse in foster care. The foster care system places orphan children and those living in dangerous living conditions in a safe environment where the child's basic needs will be met. While the program is often successful, the deficiencies in the system have often resulted in abuse and neglect of children. Abuse has serious emotional and mental development consequences. Therefore, this population must be carefully monitored and cared for. This presentation examines abuse in the foster care system. A brief history of the foster care system will be discussed first. Next, after clearly defining abuse in the foster care system, this presentation will tackle how the problem has been addressed in the past and where these resolutions failed. Finally, the presentation will close by looking at abuse in the foster care system from the perspective of the child, while also offering recommendations for how to address the problem of abuse.
Physical abuse in the foster care system is a huge issue within our community that often goes unseen. In earlier times, around the 1800s, the foster care system was created for children whose parents or guardians were deceased and they had nowhere else to go. It was created to help children in need, but starting in the 1900s, the first reported claims of abuse began happening, with legal issues to follow those. In recent history, the foster care system is most commonly used for children that have faced some type of abuse, whether it be sexual abuse or physical abuse. Um, according to the Children's Rights, nearly 428,000 children are currently in foster care at this time in the United States, and it's also reported that 28% of that 428,000 in the nation are currently being abused, whether it be physically, emotionally, mentally, which typically it is physical abuse. It is a common fact that children in foster care are more vulnerable since they have already been through that type of abuse. They accept it because that's what they feel like they deserve. And unfortunately, without without this being addressed, these numbers are going to continually rise.
In 2015, the National Child Abuse and Neglect Data System reported 1,312 foster care parents and 521 group homes as perpetrators of child maltreatment. Children placed in foster care shouldn't have to go through any kind of abuse because of the extensive requirements to be a foster parent. Those include complete criminal protective services background check, a full family assessment, reference list, home safety check, orientation and pre-service training, and licensure. This maltreatment specifically affects the children of abuse and can create poor mental and emotional health, cognitive difficulties, social difficulties, juvenile delinquency and adult criminal activity, alcohol and drug abuse, and abusive behavior. Research has actually shown that any kind of child maltreatment actually causes morphological alterations in the brain, and this is because this is seen as an adaptive response to facilitate survival in the face of adversity. Research also shows that physical abuse, emotional abuse, and neglect in childhood are important risk factors for a range of health problems and draws attention to the need to develop evidence-based strategies for preventing child maltreatment, both to reduce childhood suffering and to alleviate an important risk factor for later health problems. Only since 1988 has child abuse and neglect been documented in the foster care community. The National Child Abuse and Neglect Data System was voluntarily established within the U.S. Department of Health and Human Services to comply with 1988 Child Abuse Prevention and Treatment Act. The annual Child Maltreatment Report created by the Children's Bureau includes data from states to the NCANDS. So right now there is very little supportive evidence-based scholarly research on children who've experienced maltreatment while in foster care. Most of the research is based on abuse before entering foster care, or focuses on children of abuse that have been taken into foster care. So besides potential foster parents completing background checks, training, and licensing, little if no evidence has been found to address child maltreatment while in foster care.
The most recent data published by the U.S. Census Bureau in 2007 shows there are 500,000 children living in the foster care system. These children range in age from birth to 20 years, are approximately 50% male and 50% female, and are majority Caucasian, followed by Black, Asian, and Hispanic. Research shows approximately 2% of these children experience reported cases of maltreatment each year, and physical abuse is 3 times more likely to be experienced by children living in foster care as compared to those living outside of the system. Low funding leaves foster care agencies understaffed and caseworkers overloaded, leading to a lack of supervision and less education and training opportunities for foster families. Lack of funding brings low stipends, which not only leads to less families able to financially afford to become foster parents, but also hinders foster families from acquiring needed health care and services for their children. Unionization could help bring policy and legislative changes, which will result in more funding awarded to this system. This funding will enable foster families to receive more education and training and access needed health care and services for their children. As the foster care agencies become more resource-rich and able to provide enhanced supervision, we expect a decrease in the rate of physical abuse experienced by children living in foster care.
In conclusion, abuse that occurs in the foster care system can be traced to neglect by the foster parents or the vulnerability and ease of manipulation of these children. While child welfare has only recently been regulated in the past 100 years, federal and state governments have worked hard to regulate and license foster care facilities and parents in order to provide the best care for the children. It should be of concern, though, that much of the data available monitors the abuse of children prior to entering foster care, while data on children being abused in the system is sparse. What is clear, though, is that these children face grave consequences emotionally and mentally because of the abuse they experience. The population of nearly 500,000 foster children in the United States is at-risk community that requires special attention and care. The most significant contributors to abuse in a foster home is the additional stress faced by foster parents, in part because of inadequate funding and training. Combining the resources of the foster care system with other social services could provide more adequate support to these families.